At this stage in your improvement journey, it's very easy for teams to start to lose some of the enthusiasm that they had at the very beginning. So this short video is about how you, as the champion, might bring together 2 or 3 of your really enthusiastic team and then work together to build that energy back in the whole team. So first of all, think back on purpose. You remember that's one of the things we did the first time we met. To really think deep and hard about what's the point of the work we do. What is it that we're doing for patients and their families, both in the immediate short term, but also in the longer term? And make a statement again, either on the top of an email or a WhatsApp message or a poster as to what your purpose is. And if you've refined some of that thinking, then do it and put it into words. Sometimes reminding ourselves of what we're there for is so very important. Secondly, is around understanding how you've made progress so far. Whatever you've been doing for the last few months, I know for a fact from listening to the evidence so far from each and every one of you that you have better understood the way the work is currently done. You have better understood the challenges that there are in your system, not least the wider system, whether you're working with adult teams around transition or working with teachers around support at school, or working with patients and families who have a particular issue, perhaps around control or diet or goodness knows what. But you know more than you ever did. So find a way just to remind yourselves of who your patients are, who the professionals are that are all working together to try and make improvements, and what's the variation in your caseload or your case mix. Do you have a lot of patients who are teenagers? I'm sure many of you will have had a disproportionate number of new cases this last year. Perhaps highlight how old they are and whether they presented in an acute situation, so not so easy to manage from the point of education and development and developing a relationship as it would be if their symptoms were less severe and more easier, I should say, more easy to deal with in the hospital system. Then think about the data that you've got. Specifically, what have you tested? What have you been working on? And what evidence have you got that some of the changes that you've been making have made a difference? And if it's only a small difference, that doesn't matter. The fact of the matter is that nothing will change unless you change what you do. A system is designed to get exactly the results it gets, and so to get a different set of results, we have to make a change to the system. So if you've got data, find a way to display it. Dots on a graph are perfectly okay. It doesn't need to be sophisticated. Put little arrows to point to the week or the date that you undertook a test, or you implemented a new way of discussing time and target, for example, with your patients, or whatever it is that you've been working on. And just remember, I'm sure those of you who either have had small children or perhaps have got them now, this idea that you get in a car to go on holiday, if we can just about remember what that was like, and within a few minutes of leaving home, people say, "Are we there yet?" Well, that is a habit that doesn't disappear as you get older. People want to know how close they are to being there. So when we're displaying the data, it's good to show this is where we want to get to, this is where we are now, these are the steps that we need to take in order to get closer and closer to our destination. And these are the things that we're going to do, and this is when we're going to do them. And we'll review whether or not they need amending or changing as we make those changes and we look at the evidence that we create. Was it easy to do? Was it quicker? Was it more successful? Did it develop a better contact with the child and their family? Have we seen a change in their blood glucose levels or their willingness to download? That way you will do a few things. First of all, you'll generate the realization in the team that yes, it's hard, but you know what? We are slowly but steadily going in the right direction. Secondly, that collecting data about how we're doing is a really powerful tool to keep us all focused on what we've done and, more importantly, what steps we still need to take. And thirdly is that when we're all in it together, it's much easier for everybody. If the load of change, of ideas, of collecting the data is just held by one or two people, or perhaps even just the champion, then it's hard. Actually, everybody wants to feel that sense of purpose and value. So everybody have a job and a role and get on with making the changes. You'll find in the resource system that we've set up for you, lots of short little videos. And yes, it's a bit overwhelming to start with, to think that you have to read them all. Well, you don't. But secondly, it's a really good idea to go back into them when you've got a little bit more experience under your belt. Because as we all know, reading a book or seeing a film for the first time, there are certain things that pop out at you. When you've seen it before or read it before, other things come out at you. And that's the phase in your improvement journey that you might well be at now. So we have focused on microsystems as an approach rather than a religion because we know it helps people get purpose, gets people into a bigger team and to understand the system really well. But there are also other models that we use for improvement. And as you carry on your journey, you'll get more familiar with those and more able to mix and match. So the model for improvement is really quite simple to describe. What are we trying to achieve? How would we know a change was an improvement? And what ideas have we got that we're going to put into action to test out whether or not they actually will lead to an improvement? And then that cycle again. What's the evidence that it was an improvement, not just a change, and let's do more of it or tweak it or so on. The other approach is the lean approach, where we're definitely looking at how effective and efficient we are at doing our work. Do we duplicate things? Have we got 2 or 3 people doing things differently when we could all do it the same and make it much easier for everyone? Are there steps in the process or in the chain that really aren't necessary? And that have just got there for some reason, and really they don't add value to the work as a whole? Are there different ways that we could work with patients and their families to make our job more straightforward and more likely to lead to an improvement in the child's care? And always use the resources in your team. Many of you, hopefully all of you, will have access to a psychologist. And many of your colleagues in the past have actually had the psychologist help all of the team to think about the words you use when you're talking to patients, think about the way you talk to each other, about challenge, about barriers, about problems, and to think differently about the whole idea of communicating with children, young people, and their parents. Because their care needs to be a partnership. And building a partnership is about trust, it's about confidence, and it's sometimes about pushing the boundaries, even when people show a little bit of resistance. They don't really want to know what their blood glucose is because it might not be quite good enough, and they don't want to get into that situation. So helping them understand that you're there to work with them so that it is in the right place, if not straight away, after a few weeks of learning differently about how to manage diet, exercise, and so on. And think about the whole thing as a partnership between you, the patient or young person, their family, your colleagues immediately that you work with all the time, as well as your colleagues in education, social care, or the adult team. And when improvement is a partnership, anything is possible. And I'm pretty sure that after this point in the journey, are we there yet? Then actually, as the pandemic lessens a little bit in our lives, you will have all the resources that you need to really start to motor forward more quickly. And that's where understanding your data, being able to plot it out so you know how well you're doing, is going to be so very important. So stay positive. And sometimes as a champion, it's hard because you feel like you're giving all the time to keep people enthusiastic. So use the ideas that I've lent you, but also remember you need to get your energy from somewhere too. We heard about a great example about a team who can't meet in a room because that's not possible anymore. So they went for a walk. They chose a nice day and they went for a walk and they had a walking meeting. I think that's inspirational because sometimes we all need to look after ourselves to be able to look better and more expertly after our patients. So remember to look after yourselves, and maybe a walking meeting might work for you too.